Welcome to another Sunday WOAY ABC4 Community Forum, where we talk to community leaders and local success stories to discuss important information that affects all of us here in Southern West Virginia. I'm your host, Brandy Lawrence, and today we're joined by another distinguished guest. Dr. Shara Young, who is the Secretary of the West Virginia Department of Health, joins us this morning. Thanks so much for coming to the forum.
Thank you, Brandy. I appreciate being here.
Oh, definitely. And you're here for a very important reason. We have some important topics to talk about today, which are children's health checks.
Children's health checks, that is such an important milestone thing to do to make sure that our kids are on track.
Absolutely. And for the people out there that may not be familiar with a health check or what that entails, can you give them that information?
Great. Well, with a health check, we're talking about your annual visits that we think of a lot of times for adults, but for children, they need to be seeing their pediatrician, their primary care provider, a lot more frequently than once a year. So for example, in the first 2 years of life, you should have that health check about 10 times. Think about how much babies and infants, how much they're changing, how many developmental milestones they have in those first 2 years. They need to be having those health checks to make sure that they are developing appropriately, that they're meeting their milestones, see if they need any early intervention, and of course, preventing disease with those immunizations.
Absolutely. And I know sometimes parents, they can kind of get behind with things like that, being a new parent. But what do you typically see parents, or children go through at a health check? You say immunizations, their checkups, things like that. But for the parents that fall behind, what do you usually tell them? I'm sure they feel a little guilty sometimes.
There's no reason to feel guilty. I mean, and life happens. We may not hit all of those appointments at the right time, but as long as you're aware and you get caught up with your healthcare provider, it's important because you need to know with vision screenings, hearing screenings, dental checks, making sure that your baby is getting all of those necessary developmental milestones and meeting those. The earlier that we detect anything that could be wrong, the earlier we can intervene too. And as far as if you are behind, there's no wrong answer as far as getting caught up. Anytime is an appropriate time to get caught up. And as far as being a new parent, this is an ally in your child's health care. Your healthcare provider is somebody that you should trust, somebody that you can talk to about everything from sleeping habits to eating habits to everything that keeps your baby healthy and safe.
Wonderful. And, as, the Secretary of West Virginia's Department of Health, how do you see our state specifically? How are a lot of parents, are they keeping up, or are there some discrepancies there? And what are some things that we can do to kind of boost that?
Well, one of the things we're doing is what we're doing here today, talking to parents, talking to community folks, and letting them know that there are many milestones that we need to, and many checkpoints that we need to have for our children. From the state perspective, we look at Medicaid data, we look at how well we're doing as a state. Only 30% of kids between the ages of 1 and 3 are getting their regular checks on time and getting all of those checks. Now, it can be a lot of different factors. That's a lot for parents to do. It's a lot to keep up with. But you may also be going to your healthcare provider and when your child's sick. And so it turns into not a well child visit, but actually something to be treating an acute illness of sorts. But with only 30% of our kids under the age of 3 getting their well child checks on time, we're missing a lot of opportunities for early intervention, for disease prevention with immunizations, and making sure that you're having that conversation with your healthcare provider to keep your baby on track.
Well, to the guys out there watching or listening, it's better to know than not know, so please make sure you go to your visits and your baby's visits as well.
Absolutely. We need healthy parents too, so that's a very good point. We want our parents getting their checks as
Definitely.
well.
And they say that a lot of adults aren't going to their appointments as they should, so I think it would be great for us to start as an example for the children.
Exactly. That's always put your own mask on first in the event of an emergency, like they say on the airplanes. Take care of yourself and to help take care of others.
Absolutely.
And
West Virginia also has a Birth to 3 services program. So what does that entail?
The Birth to 3 is one of our best services that we can offer our children, and I'm so proud of the program that we have. What this is an early intervention service for parents, regardless of income, regardless of insurance type, where they can get care for their child in home to get those developmental milestones reached for their children. And they entail anything from occupational therapy, speech language therapy, audiology, physical therapy, everything to get your child up to speed and to, it is scary. Having children is scary in general because you want the best for them. You want them to stay on track. You want to give them the best of everything. And having a scary diagnosis where maybe they're not meeting the milestones is even more scary. But what we want people to know is that Birth to 3 is there to help kids get on track and give them the best start possible.
Wonderful, wonderful. And have you seen, the impact of these programs on, some of the people living in our area?
Absolutely. So this helps keep kids on track to meet more of their developmental milestones and to get the early intervention so that they're doing all of the great things that kids get to do and catches them up before they start school and hit the ground running.
Yep, definitely giving them, a head start before Head Start.
A head start before Head Start. I do like that.
So if there's anybody out there watching that would be interested in participating in the Birth to 3 services program, what do they need to do?
Well, there's several ways that you can be referred. You're getting that well child check, going and talking to your pediatrician, family physician, any of your primary care providers. They can help assist you with that referral. You can seek a self-referral. You can reach out to our Department of Health, and we're happy through Constituent Services to match you up to get more information on that program. Of course, we have more information on our website for folks who are interested in the Birth to 3 program.
Wonderful, wonderful. So hopefully we can get some more, people knowledgeable about this and more people involved, because it sounds really important, and that early development is super duper important for a lot of babies and kids.
That early development is so important, and one of the other great things about Birth to 3 is you can have those services, the physical therapy, speech language pathology, all of those services can be in an area or an office, but they also do home visits too, which takes away some of those barriers to healthcare that we see. Sometimes it's transportation that's difficult for new parents. Sometimes it's accessibility, or where you live is a little tougher to get to places, or you have other children at home and you can't find childcare to take a child to an appointment. Birth to 3 works with you so that you get care for your child and not have to give up any of those other things.
That's great. Meeting people where they are, and that's wonderful.
Absolutely.
So, and we were talking before the show about the separation of the Department of Health and Human Resources and how you all are now the Department of Health. So how has that transition been for you so far?
The transition has been wonderful. So previously we were one DHHR, with all of the programs rolled into one entity. As of January 1st, we split into the Department of Health, Department of Human Services, and Department of Health Facilities. So that gave us 3 new departments, 3 new secretarial appointments to oversee the programs. And what that's given us an opportunity to do, it's not just making sure the programs are there, it's really getting into the heart, meeting with our employees, meeting with our folks, making sure that the programs are achieving what they need to achieve, and making sure that they have the tools necessary to get to that point. Having come on last July, I served as one of the outgoing secretaries for the DHHR as we were transitioning, but we had 2 other secretaries coming in, helping fulfill those roles, and I can't imagine one secretary doing it all. We fill our days. We absolutely, from dusk to dawn, and pretty much a 365-day-a-year job, making sure services are getting to folks. The great thing about Department of Health, we are serving the people of West Virginia literally from birth, whether it's your birth certificate or it's a Birth to 3 program, getting your well child checks, all the way through death, all the way through your final death certificates, the Office of the Certified or Chief Medical Examiner, and everything in between, including Office of Emergency Medical Services. We help make sure that the folks of West Virginia are safe at the worst time, at some of the worst times in their lives, because we help manage and certify our EMS community. We have so many great programs that I'm proud of. I could go on all day, actually, about the great folks that we have, but it's been a wonderful transition.
That's really great. And I can imagine, your hands are full just as Department of Health, for an entire state. And I know that West Virginia sometimes has some unique issues that we face. So it's really wonderful, what you all are doing, and it's really awesome that you all are able to focus more on the health aspect, and we have different departments to really cater more time to one specific thing.
Absolutely. So, for example, we have the Office of Tobacco Cessation, or into smoking cessation. We also have the Cancer Registry. And so, while all of these things are different programs, what our people are doing now that we're a smaller department, a more manageable department, not only just looking at numbers or statistics, but putting together, how do we help people quit smoking? Why do they smoke? What focus areas do we need? How can we make the biggest impact? And looking at the downstream effects, knowing that we have a high lung cancer rate in the state of West Virginia, how can we get not only folks to be aware of the risk factors sometimes of smoking, but also where they can get care, the early intervention, and then partnering with our hospitals and our other healthcare facilities throughout the state so that people get screened and understand that there's treatments that may not have been there before for such things. So it's really putting all of those pieces together.
That's great. That's awesome. And, speaking of which, you were talking about smoking cessation and, the attention to lung cancer in the state. Mm-hmm. And that's really important, for our overall health and things like that. But I know that also that WIC has decided to go into a fresh produce program. So they're also helping people eat better as well.
That is a major factor in keeping people healthy. So while we have other preventative measures, starting with a healthy foundation, a healthy diet, that is something that WIC has been able to provide. This year, WIC is celebrating their 50th anniversary, which really speaks to the milestones of how much the program has changed within 50 years. One of the newer programs that we have now, though, is that we have fresh fruits and vegetables, fresh produce that isn't always available in some areas. So, we're talking about serving the entire state. And I'm from Wyoming County. I grew up in Wyoming County. I now live in Kanawha County, and I can tell you it's a different environment and different accessibility. And for folks, even in Kanawha County, they think because we have Charleston and we have larger cities and more access, there's areas where there are nutritional food deserts, fresh food deserts, that you would be surprised how many people lack the access to fresh fruits and vegetables. The WIC program gets this throughout the state, aligns with our partners in agriculture, the people who are growing fresh food for us and getting that nutritional food instead of all the processed foods and things that sometimes we're stuck with. Getting that on the plates of kids and families, making them healthier, not only now, but making that prevention down the road.
Yeah, that's really great too. And I saw that, their local farmers markets can also opt into the program and also be providers. And I know we have a couple locally. So, if anybody is watching out there, anybody that has a farm or a farmer's market and wants to help out, please get in touch with the DHHR, wv.gov/health, and see how you can get involved with that so you can help feed your community.
Absolutely. The more people we have to the table, the better. And that's with healthcare providers, that's with our health community, that's with all of our community engagement. We have a lot of work to do in West Virginia, and so we appreciate our farmers and our farmers markets and everyone keeping us healthy and safe.
Absolutely, good stuff. All right, so we're about to go to our first break. So you all stay tuned. I will be right back here with Dr. Sherry Young, and we're going to talk more about the West Virginia Department of Health and all the things that they're doing to help with children and us adults. Welcome back to Sunday Community Forum. I'm here with Dr. Sherry Young, who is the Secretary of the West Virginia Department of Health, and we're talking about all types of things, wellness visits, health checks, birth to 3 services, and ultimately all the things that keep all of us healthy here in West Virginia. So during the break, we were talking about back to school immunizations. We'll be back to school before we know it. So,
absolutely.
What does the department, ultimately recommend for immunizations? And also, how do you all promote immunizations in a world where some people are not really feeling them anymore?
Immunizations is a tough subject, and so the best thing that you can do, talk to your healthcare provider. Again, your healthcare provider is the person that you should trust most, because literally they have your life in their hands, and they have your best interest at heart. We do have back to school coming up. I can't believe we're talking about it mid-July, but it is right around the corner. And so we do have immunization requirements for new school enterers and a couple of requirements for 7th and 12th graders, and that's to keep our kids safe. We give examples of vaccine preventable diseases. And so one of the ones I'd like to talk about that we touched on, for the first time in 15 years in the state of West Virginia, we had a case of measles. And this really put a lot of spotlight on the importance of immunizations, because very quickly, with one case, it affected immediately 139 West Virginians who were exposed. Now, some of them had immunizations, some had not. And so if you're not up to date on your immunizations and having that conversation with your healthcare provider, it could have very easily been other folks that were affected by this. So we're very lucky that it was only one case, and I think some of our strong immunization requirements did help that, but we want people to feel safe in the environment of talking to their healthcare provider. Not everybody can get every immunization, and that's an important conversation too. That's why we have exemptions and medical exemptions, but having that conversation of how to keep your kids safe, that is part of that conversation. Going back to the measles case, 139 people were exposed. Even for one case, the mere cost of it was over $75,000 for the state, and for the investigation piece, for shutting down the offices, for doing the contact tracing, and several man hours and a lot of staff within Monongalia Health Departments and 28 other health counties and health departments investigating to make sure that people are safe. So while we have all of these safety measures in place, it's always better to have that better primary prevention through immunizations to keep our kids safe.
Definitely. And I think a lot of people probably didn't think about how much work it takes, how much money it takes to really prevent these diseases and these illnesses when somebody contracts them. So I'm really glad that you brought that up, and I always learn something new at Community Forum. I think that's one of my things for today.
Well, thank you. And it's eye-opening that even one case could have that kind of a ripple effect. And, because we do have a high immunization rate, I think that did protect more folks from being exposed. But you look at other states that have not fared as well, and children being hospitalized, and there's a lot of downstream effects that's why we need to have these conversations. We don't want kids to be hospitalized if we can prevent it. And we don't want people to have to, we don't want to shut down offices and take all that man hour, and that's a lot of, not to say in terms of money, but that could have been invested in a lot of other things for our state and a lot of other places where we needed that. So that's a resource to think about every time we do have a case.
Definitely. And it's that aspect, and then it's also the aspect of keeping other people healthy, and because like you said, some people can't get immunizations, and especially when it's applying to kids, they may not be scheduled for that yet, so they can't get it, and now they're exposed. So
that is such a good point. So your MMR vaccine, you should have your first dose around 12 months of age, or 1 year, and then your booster between ages 4 and 6, right before you would normally start school. So you have very young infants that cannot be immunized yet. And even outside of that, the MMR vaccine, very effective, about 94% effective for the first dose, and even higher for having had the second dose, with a lifetime immunity towards measles. That's great. That helps protect folks. But we got to think too, people who may be having chemotherapy, on biologic agents, who have weakened immune systems, they don't have that line of defense. So not only are we keeping our youngest and most vulnerable West Virginians safe and our kids at school safe, we're really protecting many more West Virginians than we're thinking about.
Absolutely, absolutely. You got to keep everybody safe, guys.
That's right.
And we can't really get too in-depth into it, but I did see the Department of Health will be partnering with the Department of Education and Aetna Better Health for a Kids Health Challenge.
Absolutely. We are going to make a big splash and announcement, but we do have some great things coming on the horizon as far as acknowledging schools and getting kids to participate and showing healthy habits. So one of the things that I'm very passionate about, as well as the Department of Education, our Department of Health, very excited about getting kids healthy. And while we have to deal with a lot of illnesses and chronic diseases within the state, we get to do some fun things too. And so this is one of those fun initiatives where where we get kids involved in eating healthier, being more active, and not only showcasing what they are doing now, but also giving prizes and encouraging them to think outside of the box to be healthier West Virginians. And a lot of times, even as parents, I will say this, as a mom, sometimes we learn from our kids too. So kids can take these healthy habits home to their folks.
Absolutely, absolutely. Like we do a lot of, we see a lot of like health segments about screen time, and they really recommend that the parents start with screen time first. So, you know, the kids will learn from the parents, but when it comes to healthy habits and playing outside and things like that, of course the kids are going to like that more. So we can learn from our kids by going outside and playing with them and just getting more active. So I think it's a give and take.
Definitely. We can all put our phones down a little bit more. I'm guilty of that too. But, you know, getting outside, being healthier, getting involved with your kids, that's value added. That is not only a great time to bond and do great things, but getting healthy together.
Absolutely. Well, I think this challenge will definitely work. I know kids love to play, and I think this is probably the perfect time to get them to get out and play. It's been so warm and hot in some places. You know, they can get out, go swimming, do a bunch of different activities, and there's some incentive involved too. There's some prizes potentially involved. So I think this will work. I think we're going to have a lot of healthy kids in West Virginia.
I love that. And so you bring up something too. You know, we have had a lot of heat advisories and things lately. You know, kids are going to not only be starting back to school, but starting sports sooner than even school starts. So keep active, keep outside, keep staying healthy, but keep hydrated and kind of watch for signs of heat exhaustion and those things too. So we can do it, but we have to be careful about that heat sometimes as well.
Yeah, definitely. Yeah. Oh, and speaking of like extracurriculars and sports and things like that, I guess kids are also going to need a wellness check or a physical for that too.
Absolutely. So, you know, you can time your child's back to school visit with their well child check. And so in kids who are in sports, that's a separate physical and a separate form that needs to be filled out to make sure that they're healthy enough to participate in sports. And so these are extra ways for us to engage with our healthcare providers to make sure that our kids are staying on track.
Definitely. So let's see. And back to kind of our health check. I noticed, like going through the talking points, that health check employs non-community-based regional program specialists to help Medicaid providers with necessary tools and resources. For Medicaid recipients. Why is it so, recommended that they really take advantage of this program? I do see that, it's for everybody, but Medicaid is really, at the top of the list of, get out there and do these wellness checks and really take advantage of these programs.
Absolutely. So Medicaid is a partner that we use that is a payer source for, hundreds of thousands of West Virginians. And so, where we were previously DHHR, it used to be one big program. We still partner on a lot of those initiatives. And so for our Medicaid providers, it's another way that we can look into the system and say, how many kids are getting their well child checks? That's where we're getting a lot of our data, that only 30% of our kids between the ages of birth to 2 years old are getting their regularly scheduled exams. So it's a good pulse point for us to work with our payer partners to look at where we need to do better. And that is definitely one of the places that we can do better as far as getting the numbers up and keeping kids on track. The EPSDT program or the wellness program that we have within the Department of Health works with Medicaid to make sure that nobody falls through the cracks, so that everybody has that access to health care. And so we have several programs that help lift families up, whether it's in their time of need or regardless of what adversities that may be occurring, we're lifting them up and making sure that they have all the tools that they need.
That's wonderful. And there was another new thing that I learned. I didn't know that a lot of the data was coming from that as well. So, it's really awesome to see how it all works together and to see where you really get these numbers from and how we, as West Virginians can come out and just help by simply just going to the wellness visits and doing what we need to do and really bring those numbers up.
Absolutely. So we want to do that for our kids, but you made a great point earlier about our adults need to be doing the same thing too. We talk about back to school immunizations, very important, but there's a lot of immunizations for adults that they need to be keeping on track for some to prevent illnesses, whether it's for shingles vaccine. Shingles is a very painful disease that can affect adults more likely over the age of 50. Have that conversation. Trust me, the immunization is way better than having shingles, and anybody who's had shingles would probably tell you that as well. But making sure we're up to date on our tetanus vaccines and things that we don't think about every day until something happens or we need those things. So encouraging our adults to stay healthy as well.
Definitely. And I know one big vaccine, I know usually for kids to get, is the chickenpox vaccine, and that actually came out when I was first going to school. So I was like one of the first kids to get one of those vaccines. And while my sister had chickenpox, I never have. So it works. It pays off, and you would rather get the vaccine than have to deal with chickenpox or the shingles along the line.
Absolutely. So the chickenpox vaccine is relatively new to other vaccines. MMR's been around since the 1960s. The chickenpox came out in late 80s as far as the recommendations. We tend to look back and think about things as routine childhood diseases. And so we get a little complacent about vaccines, meaning that, sometimes we forget that with measles or with chickenpox, kids could get very sick, and a lot of kids could end up being hospitalized and be very sick or even have permanent damage from these diseases. So while it's great that it's in the rearview mirror for a lot of our folks, we need to keep that messaging that these can be very serious illnesses and very contagious too. To give you an example, going back to measles, as far as how contagious measles can be, if you have a room of 10 unimmunized folks or that have no immunity, most likely 90% of them, 9 of them are going to contract measles just from the aerosolization of the disease, even though it's, we think of it more being skin to skin contact because of the rash associated with it. These are things that we need to think about keeping our kids safe. And you're right, as someone who had the chickenpox, I'm very glad that you didn't have to suffer through that and had the immunization instead. While I fared probably pretty well comparatively, it's not something that's very pleasant to have at all.
Yeah, definitely. Well, thank you so much.